Hi, this is Junaid back with another video. Today we're going to discuss a new series which is called Healthcare Policy Corner, and we're going to start with telemedicine during and after COVID-19 pandemic. Before we start, I want to give a special shout out to VMed. This is a telemedicine company that is actually donating their carts and their tablet-based telehealth equipment to hospitals during this urgent need and national crisis of this particular pandemic. So special shout out to them and thank you for doing it. As we know, with this particular situation, patients or doctors are turning to telehealth, but what really is it? And then most importantly for us as physicians, what do we need to look forward to, and what are the policy changes that are coming down the pipeline? So this is the particular act that was passed by President Trump, Telehealth Services during certain emergency periods Act of 2020. And what it basically did was that it produced a waiver for originating site requirements. Initially, it was that for certain telehealth applications, there was a requirement that you have to be within the same state or same locality, etc. However, after this particular act, there is no particular requirement except that the originating site will be in United States. Who can perform telehealth services? They did not redefine the provider requirements. The provider requirements include originally through the prior Telemedicine Act as physicians, nurse practitioners, etc., and they will remain the same. The new provision is that it can be provided via smartphone. I am getting conflicting reports from two different sources that if you can use non-HIPAA compliant like Skype, my short answer is don't use it. Use HIPAA compliant services. Enough are available, but at the end of the day, you can use your own smartphone and not a company provided specified equipment for physicians to provide telehealth services. That's for sure. When will this be effective? And I'll come to the next slide just discuss that and what is the duration and the scope of this. And that is, to be honest with you, up in the air right now. And there is some uncertainty that what would be the overall duration of this particular act, and how much will it include? Will it include only the coronavirus situation, or will it include anyone during that period? The short answer is that anyone who is requiring care in this situation will be provided through this particular act. So for example, I have a stroke patient I need to follow up in clinic, and if they can't show up for any reason whatsoever, and if I do provide that care over tele, we will be reimbursed for it. How long will it last? That's a separate issue. So this was the actual release. This is directly from the CMS website. As you can see at the very bottom, you will see that these are the two fact sheets and the press releases that the President Trump expands telehealth benefit for Medicare beneficiaries during the COVID-19 outbreak. And there's a fact sheet attached to it. And this is the particular differences that the situations that this is going to affect. Effective March 6th, Medicare will pay doctors, hospitals for a broad range of telehealth services on a temporary basis. Again, there's no stop date to it, and I don't know when will be the stop date, but at the end of the day, Medicare will pay the reimbursement for these services. The pay will be for office, hospital telehealth services, including nurse practitioners, clinical psychologists, and social workers, and telehealth visits will be reimbursed at the same amount as in-person visits. Previously, this was only, the term we use is pay parity. So there's going to be a pay parity between in-person visit and a televisit. That was only in California law that there will be a pay parity between telehealth and in-person visit. I don't believe anyone else had that pay parity as far as state law is concerned. However, according to this particular act, there will be a pay parity during this emergency period. So those are the things to keep in mind when we are looking at telehealth services for physicians that are providing care for acute patients of theirs. The type of services that is actually, this is directly from the fact sheet. So Medicare telehealth visits will be defined as telecommunication system between a provider and a patient. This is the red box indicates telehealth consultations. This is G0245 to 425 to 427. And this is classically time-based services built like a critical care service. And if I'm seeing a telestroke patient, technically my billing goes through this. However, there is now codes for office-based visits and outpatient visits. They also included virtual check-ins. So for example, if there is a nurse that's going to come and take vitals and then do everything and review your allergies and medications like you would go into a normal office, if they do it on the virtual basis too, they'll be reimbursed for those. And then of course, e-visits are exactly as those e-visits that were reimbursed prior. And so those same codes stay the same. I will do a complete series on this. As a matter of fact, I was working on it until this suddenly came up, and I thought it is important to bring this to light for people. And then all this background will be part of a separate lecture series. This expansion of telemedicine services is not new. I mean, to be honest with you, this has been going on, and the question really has been, why hasn't it been broadly adopted just yet? Because there are things that, to be honest with you, can be done much better via tele, including telestroke, because you cannot have an expert at bedside at every place, and it's just impossible practically. I mean, we have the technology to bring the expert to you, why not? And specialties like telemedicine, tele-emergency visits, especially urgent care, and telepharmacy are, to be honest with you, no-brainer in some situations, because that is very cost effective, and more importantly, in situations like these where will be viruses that can be transmitted to each other, this is actually much better than physical visits, both in terms of cost, disease transmissions, etc. To be honest with you, this is what we're looking at with the COVID-19 situation, is a complete cultural shift in the making. There's a beginning of a new remote era. We're going to be starting remote working, remote learning, and of course, remote healthcare. This is a prediction. I may be wrong, but to be honest with you, majority of non-procedural specialist care will be delivered via telemedicine in the next 5 to 10 years. We'll see. I may be wrong. Again, I want to give special thanks to VMed for donating their cards and tablet-based services to people in need in this special situation of national emergency. Thanks again. I will actually looked at when I reached out to them to say thank you for doing that. They came back and said, hey, we have this whole slew of things, and I said I'll be happy to look into it. The initial impression is very good. I'm going to do a complete review on their card, the doc, and the clinic, and we'll see how it fares with different other systems out there in the market. But by initial impressions, it seems like a very user-friendly system, very quick in and out, operating system agnostic, and it's very fast and efficient that you can use on any device. So initial impressions are great, but I'm going to do an in-depth review for you guys when I get more versed with the system and actually be able to see what are the deficiencies of it as well. Again, thank you very much for tuning in. I appreciate it. Please visit, provide me with feedback, and subscribe to my YouTube channel.